Now we will discuss meningococcal meningitis. It's a common problem of children and older people. People may die due to meningitis because there is neck stiffness, there is fever, there is meningeal irritation. So we need to control meningitis, and there is a problem that it spreads through carriers predominantly. So carriers may don't have symptoms, but they spread the disease rapidly. So we will discuss this lecture according to following learning objectives. We will define what is meningitis, what is epidemiology of meningitis, what are clinical features, what is management, and in the end we will summarize the session. So let's start with the definition. Meningitis is a disease that is caused by inflammation of meninges. There is swelling of meninges due to infection which surround the fluid in the brain and spinal cord have the infection. There may be bacterial meningitis, Neisseria meningitis. There may be viral arboviruses. They may cause meningitis. Herpes simplex may cause meningitis. Enteroviruses may cause meningitis. Two main bacteria, Neisseria and Streptococci, they cause meningitis. So there is bacterial and there is viral meningitis. There may be fungal meningitis, histoplasma. You can remember only one of them. There is parasitic meningitis, strongylosis, they cause the meningitis. How they cause? They contaminate the soil and water. Then they cause meningitis. They can also contaminate food. Then there is non-infectious meningitis that spreads from person to person, but instead caused by cancers, SLE, or certain drugs, head injury, brain surgery, they cause meningitis. So there are 5 types. This may be asked: bacterial, viral, fungal, parasitic, and non-infectious. But the predominant is bacterial. Streptococci and Neisseria, they cause the meningitis predominantly in children and in the people of old age. What is epidemiology? You have to remember the agent, Neisseria. This is predominant agent that causes meningitis. It's a gram-negative diplococci. There are 12 serotypes. There are more than 12 serotypes which spread the disease or which cause the disease. So things to remember: causative agent, gram-negative, aerobic diplococci. Then there are at least 12 serotypes and common MCQ that spreads from cases and carriers. There are epidemics of meningitis. People who are living in our crowded places, urban slums, people who are going for Hajj or to perform their religious duties can suffer from meningitis. What is source of infection? Clinical cases, they are source of infection, but carriers are the most important sources of infection in meningitis. Carriers spread meningitis. Period of communicability, when they are secreting meningococci from nose and throat. Nose and throat secrete meningococci and cause the disease. All the ages are susceptible. Younger group are susceptible. Younger means children. They are susceptible because they have low antibodies. Immunity can be acquired after subclinical infection or after the disease. Infants can derive immunity from mothers, so it can affect any age. But after one infection, after subclinical or clinical disease, one may be immune. There are environmental factors. Their outbreak occurs in dry and in cold months. Or there are outbreaks of meningitis in schools, in barracks. Barracks are mentioned in scenarios. In refugee camps, like in wars, people are living residing in refugee camps. In floods, in earthquakes, people are residing in refugee camps. Army persons are residing in barracks, in schools. There is overcrowding. They suffer from meningitis. So we need to control meningitis in people who are living in barracks, in schools, in refugee camps. And it's a disease of low socioeconomic status like tuberculosis because they have poor housing conditions. Disease spreads from person to person. It directly spreads from person to person by coughing, by kissing. So one person who are living in same room, if one gets infection, other may be infected. So there is secondary attack rate in meningitis. Incubation period varies from 2 to 10 days. Range is 2 to 10 days. or there are 3 days, 4 days. These are the common symptoms of meningitis. It starts from headache. There is altered mental status due to meningeal irritation. Person can have photophobia. Person have ear may suffer. It can affect ears, head, eyes. Then there is neck stiffness, most common feature in children especially. There is high grade fever. So person who is suffering from fever has high grade fever, has neck stiffness, has photophobia, has can have headache, mental status is altered, muscles are involved. There may be petechiae during the infection. So how can we distinguish infection of children and older ones? Children may have fever, cold feet. Adults may have vomiting, difficulty to wake. There is confusion, irritability. There is muscular pain in children. Body becomes pale, stiffness. Children can have severe headache. Older ones can have neck stiffness. There is confusion. There are lights on eyes. So a person will tell you he has vomiting. Our parents will tell you children has vomiting. Our children has cold feet or hands. He is suffering from pain. These are the common signs of meningitis. A person comes to you, or a child, or an adult who comes to you with high grade fever, with neck stiffness, with altered mental status. You need to treat meningitis immediately. Otherwise, he or she may die due to complications. It's a disease which can cause mortality in both children and in adults. So early diagnosis is important. Diagnosis is done by lumbar puncture. You can do lumbar puncture in lumbar spine and diagnose it by PCR or agglutination test. So spinal fluid, CSF is observed in case of meningitis. It should be done immediately. How can you prevent and control meningitis? As we have discussed, there are cases and carriers. So cases should be treated with antibiotics. Which type of antibiotics? Penicillin. Nowadays, cephalosporins. Third generation cephalosporins are given. Penicillin is given to those who are allergic with penicillin. Cephalosporins are given to those who are allergic with penicillin. These should be given. Treatment should be started immediately. You can give cephalosporins intravenously. Then, how to manage carriers? We have to identify carriers. We have to diagnose carriers and give them rifampicin. This is a common MCQ that management of carriers of meningococcal meningitis is with rifampicin. People who are in contact, they should be given antibiotics. We have to start antibiotics cause this a bacterial infection. Then there should be mass chemoprophylaxis. Why? People who are living in barracks, in refugee camps, who have gone for Hajj, Umrah, or to perform their religious duties, they should be given mass chemotherapy. They should be given antibiotics to reduce the burden, to decrease the burden, like ciprofloxacin, minocycline, spiromycin, ceftriaxone. These are prophylactic antibiotics. These should be given to them who are susceptible, who are in close contact with cases of meningitis, who are living in close vicinity, who are living in overcrowded places. As we know that there are outbreaks of meningitis during Hajj, during religious duties. People of subcontinent, they are religious. They suffer from the disease most commonly. They are poor, they suffer from disease. So we have to give them prophylactic antibiotics. That's how we can control meningitis. We can reduce the burden of meningitis. There is vaccination. Remember, the common university question that which vaccine which is not included in EPI schedule can be given. Meningitis vaccine. We can give meningitis vaccine those who are at high risk, travelers, school children, older people, people who are living in barracks during disasters like earthquake, floods. People are residing in camps. We can give them the vaccine. There is meningococcal polysaccharide vaccine, conjugate vaccines. So you can give these vaccines intramuscularly. The dose is 0.5 ml. This is the route of transmission. This is the route of administration of the vaccine. So we should give the vaccine. These are the vaccines. Meningococcal meningitis vaccine. The quadrivalent vaccine should be administered in children less than 2 years. They should be given the vaccine. If there are outbreaks, if there are epidemics, everyone should be vaccinated against meningitis. Because elders can play as carriers. They can become carriers because their immunity is greater, so they can develop subclinical infection. But they will transfer the disease, so they should also be vaccinated during epidemics of meningitis. There are many complications of meningitis. People who suffer from meningitis can have cranial nerve paralysis, nerve palsy. So nerve palsy is common complication of meningitis. Venous thrombophlebitis, cerebral edema. These are the common complications of meningitis. Children can develop subdural effusions. There are long-term, or we can say that mortality, morbidity increase. There is permanent meningitis, ischemic necrosis. So you can remember nerve palsy, venous thrombophlebitis, cerebral edema, fulminant meningococcemia, or loss of skin and limbs. These are the common complications. These may be asked. Now we will summarize this. We have discussed what is meningitis, what are the causative agents of meningitis, what are various types of meningitis. Meningitis is inflammation of meninges that involves brain and spinal cord. It's a bacterial disease. It can be viral, it can be fungal, it can be parasitic. Then we discussed various clinical features. So we discussed epidemiology. We discussed the incubation period of meningitis. We discussed the causative agent, Neisseria meningitis, people who are susceptible, children and older ones. It can occur during cold seasons. It occurs in barracks, in school, in refugee camps. Incubation period, 2 to 10 days. It remains communicable. Then we discussed clinical features. Like there are two main clinical features: neck stiffness and headache, neck stiffness and high-grade fever. These are the main clinical features of meningitis. Then we discussed management. As we discussed that it spreads through carriers, predominantly through carriers. So we need to manage carriers. First, we need to identify the cases. First, we need to diagnose them. We diagnose them by lumbar puncture. Then we treat the cases by penicillin, ceftriaxone. Then we need to treat the carriers. We need to treat the carriers with rifampin. We need to treat the contacts. We can give prophylaxis or chemoprophylaxis to those who are travelers. Then there is vaccination of meningitis. During epidemics, we need to vaccinate high risk ones, or we need to vaccinate everyone who is at risk. Vaccine can be given, although it is not included in EPI, but it should be given. Then we can summarize that these are the symptoms of disease. Meningitis is caused by Neisseria, transmitted from person to person directly. All younger children are susceptible. What are the symptoms? These are the major symptoms. There is sudden fever, there is vomiting, there is headache, there is neck stiffness. You can remember this. You can remember nausea, sensitivity to light, and babies and small children. They suffer from high-grade fever. They usually cry. They don't take the feed. Mother or parents will tell you that baby is not sleeping properly. He's not taking the feed properly. There may be rash. So you need to diagnose this. You need to treat this to reduce the mortality, to reduce the burden of meningitis. Meningitis is a commonly asked question in exam. Three or four important points, like carriers should be given rifampin. Drug of choice is penicillin and cephalosporins. Main clinical features are neck stiffness and high-grade fever, vomiting, photophobia. It is diagnosed by lumbar puncture. You can remember the prevention, like you should isolate the patient. You should notify. There should be disinfection. Hygiene should be improved. There should be health education. Nutrition should be improved because it's a disease of low socioeconomic people. It's a disease of poor. We can improve their diet. We should educate them. Then we can stop the transmission. We can stop the droplet infection by early treatment and diagnosis. And patient comes to you with neck stiffness and high grade fever, take it as a case of meningitis and start the treatment immediately. Cause children may die due to high grade fever, due to neck stiffness. They become unconscious. They can go in coma because they have lesser immunity. You should start a treatment. Then you should vaccinate. So these are these are the important points regarding meningitis which should be remembered.